Hi everyone, this is Justin Vaughn with MiraMed Global Services. Our article today is entitled Temporary Survey Rules for Hospitals. Do you remember when rules were set in stone? No matter what the extenuating circumstances or the reasonable excuses, the rules were the rules, and they were to be followed without exception. Well, that hard-nosed notion has become a bit mushy as of late, what with all the government waivers and temporary measures and turning a blind eye during the current public health emergency, or PHE. It seems as if the tight-run ship approach has become more akin to a party barge where anything goes. Of course, a relaxation of the rules in times of crisis is not necessarily a bad thing. In fact, in the minds of many, it has become downright essential, especially for those in the healthcare industry who are trying to save lives while simultaneously struggling to stay afloat. Many are thankful to a responsive government that knows when to ease up on the enforcement and let certain things slide. Such is the case for a temporary ruling issued by the Centers for Medicare and Medicaid Services, or CMS, late last month. This section is entitled, Relaxing the Rigor. On January 20, CMS directed its surveyor agents to significantly relax their scope of operations within the hospital setting for 30 days from the issuance of the directive. Moreover, this temporary guidance is subject to possible renewal involving additional 30-day periods. The move was sparked in part by a request from the American Hospital Association, or AHA, to eliminate or severely restrict surveying activities during the pandemic. In response, CMS has announced that during this initial 30-day period, it will be suspending certain hospital surveying activities as reflected in the following. First, hospital complaint surveys. Hospital complaint surveys. These will be restricted to immediate jeopardy complaint allegations. According to a CMS memorandum on the temporary survey restriction, the agency will place a priority on on-site complaint investigations pursuant to the following circumstances: imminent danger to patients at the hospital, non-compliance with Medicare hospital conditions of participation, or COPs, likely exists, and immediate action must be taken to protect the health and safety of patients. The agency made clear that such investigations will be limited to those COPs that are needed to ensure the health and safety of patients who are in imminent danger. An investigation of the infection control COP will only be authorized by CMS if the allegations support findings in this area. Focused infection control surveys will be required by CMS only for those complaints with allegations that support their inclusion. The CMS memorandum went on to state, quote, while the circumstances above outline the priority expectations, CMS may authorize on-site investigations anytime as determined appropriate by the CMS Survey Operations Group location, end quote. Second, hospital recertification surveys. Hospital recertification surveys. These surveys will be suspended, quote, except for a subset of hospital reaccreditation surveys per additional guidance that will be forthcoming, end quote, according to CMS. Notably, those hospitals that are scheduled to soon receive a recertification or reaccreditation survey will have their certification automatically extended for at least 30 days due to this directive. The CMS memorandum of January 20 asserted that additional guidance on accrediting organization reaccreditation surveys will be forthcoming. In addition, such organizations will be directed to halt their reaccreditation surveys for 30 days, quote, and instead perform a targeted sample of reaccreditation surveys using a modified survey process in hospitals that meet defined parameters, end quote. Third, and finally, are the hospital enforcement actions. Hospital enforcement actions. Lastly, the CMS directive of January 20 on this topic noted that, quote, actions for deficiencies that do not represent immediate jeopardy will have their termination date extended for at least 30 days, end quote. In other words, hospitals will not need to submit a plan of correction, nor will a revisit survey by the state survey agency be required. This is to include desk reviews. And according to CMS, hospitals, this is a quote, hospitals that have an uncorrected immediate jeopardy must demonstrate removal of the immediate jeopardy findings through an on-site survey. Once the immediate jeopardy has been removed, the above protocol will apply. That's the end of the quote. This final section is entitled Returning to Reality. All of this allowance and abeyance will not run on in perpetuity. Following this 30-day period or any announced subsequent 30-day periods, quote, hospitals will have up to 60 days to demonstrate compliance with any outstanding deficiencies, end quote, per the CMS memorandum. The agency will be issuing further guidance pertaining to these temporary survey provisions prior to their termination. For more information on and to keep track of the survey suspension directives, please go to a CMS link that you can write into your browser, Hospital Survey Priorities CMS. Hospital Survey Priorities CMS. That should take you to the proper link. And as always, if we can help you in any way, or if you have questions about our services, you can contact us at info@miramedgs.com. Thanks so much.